I'm Nick D'Angelo, patient coordinator at Sponaugle Wellness Institute, and today's a pretty special day for you, Sadie. Today is your last day here in treatment, and we want to be introduced to you, introduced to your story. So tell us a little bit about yourself. Where are you from, how old are you, and how long do you feel like you've been sick for prior to coming to Sponaugle Wellness?
Okay, I'm 17 years old. I'm from Houston, Texas, lived there all my life. I thought I was sick for about 4 or 5 years, but it turns out I've been doc speculated all my life. I contracted mold toxicity in the womb, and that I was bit with Lyme disease when I was 7.
Okay, so you've got, when you arrive here, you got a combination of things going on.
That I didn't know about.
Yeah, and talk to us a little bit about that. So you didn't know anything about that. What did you know prior to arriving here about yourself?
I did know that I had a misdiagnosed bad OCD, paranoia, Tourette's, ADHD, mood swings like BPD, and mold toxicity. I found out my cousin Emily Ann French was here, and she went to the seminar, and I was going to doctor trying to figure out what's wrong with me. And she called and she said, "I think I know what's wrong with Sadie." And she said, I think it's mold toxicity. And I got tested in Texas, and they said, "Whoa, yeah, you're full of mold."
Yeah.
So I started going to a clinic there, and I realized I just need to get on the waiting list to be here, because this is, they need, doc can treat me exactly how I need to be treated.
Sure. So prior to ever coming in here, you already had kind of a history, built up a relationship with your doctors, things like Tourette. You mentioned the OCD. How were you going about dealing with those things for those years?
I went to an OCD clinic for a couple of years. I was an outpatient, but I went about 3 days a week for a couple hours, and it was exposure therapy. It was really hard to do. I was, I think, 12, 13, 14, and I was on medication. I was on about 4 or 5 medications when I was 12 and 13, and that was really hard. I think that was probably the hardest. That was the hardest point, because I didn't know what anything was going on. I just thought it was genetics, and so I was just on medication and therapy for years and years.
And that's obviously got to be very tough, especially coming into your teenage years. Very much your quality of life is driven by self-image, and the way you perceive yourself was, I'm a sick individual. I have some genetic issues, some deficiencies, some. You're working from a deficit as far as you compared to other kids.
And then people tell you, because Lyme disease and mold is so hidden and sheltered, people tell you that there's nothing you can do about your mental illness. Just keep it under control. But then you come here and you're like, whoa, everyone has exactly what I have. Sure. And everyone's getting better, so you have all this hope.
Sure. And so you get here, you find out, wait, there's other people like me first. You find out that there's a way to treat this, and we start treating with you. How did that go for you? What kind of changed? What progressed as we went through the treatment with you?
I actually had moderate to severe memory loss, short-term and long-term. So I couldn't really remember early on in my childhood, like mentally and the physical pain.
Sure.
So once doc started pulling out the toxins and the infection in my brain, which he later found out that I had a deep brain infection in the center. Yeah, I remembered as a kid growing up, I had all kinds of physical pain, but I didn't remember it because they were like, "Oh, it's growing pain. Yeah. Oh, you stub your toe." It's because I was all in my joints and everything. And I told my mom my memories were coming back, and she said, "Well, when we went to Pennsylvania when you were 7 years old," she's like, "You got really sick." And Doc later found out that I had Pennsylvania Lyme, but he found it out after he started busting through my layers of biofilm. Because when I first got here, he's like, "Oh, there's no sign of Lyme," but now he was like, "Whoa, it's everywhere." And
what's incredible about what we do here is you kind of unravel your medical history as you continue to push through it. So we're forcing toxins out of the brain, out of fatty deposits in the body. We're working on biofilm, and it's kind of like tree rings.
Yeah, exactly.
And so we get back to what happened 5 years ago, 6 years ago.
Yeah. I call it lasagna.
Yeah, like getting to the best part of the lasagna.
Yeah,
so
exactly.
Getting through the cheese and the pasta and getting to the meat of it, and so we started getting through the meat of it. And how did you progress? What kinds of symptoms went away? How quickly did those go away? And then where do you stand now?
Right now, I feel happier and better than I have in years and years and years. I didn't think I could feel this clear mentally, and I didn't think I could get my memory back as much as I have. I feel like a different person completely.
Yeah.
but it was tough going through it. I feel I've been here 7 months, but I feel like I've been here 10 years just because all the things that I've overcome and found out about myself. Yeah. When I got here, when I started clearing toxins in my brain, I was in a wheelchair for about 6 weeks to a month to 6 weeks. I went through these things called frontal lobe comas where I would pass out for about an hour and a half.
Sure.
But I was awake in my brain, so it was paralysis. Yeah. And then I was on a cane. I was so stubborn because I didn't want to be in a wheelchair, so I had my cane for about 2 months, and it was kind of funny, but it was.
Yeah, and today the physical pain. How's that right now?
Every once in a while, I'll go through like a small kill, but they're nowhere near I was. You know, ask anybody, any of the nurses. You know, they saw me down there. I was shaking, and now I can go to the movie theater. I'm wearing heels right now. I can.
Look at you.
I'm a different person. Yeah.
17 and in heels. You're getting it done. Mm-hmm. What about You mentioned the OCD. You mentioned the history of Tourette's and all of that. How's that improved for you?
That's improved majorly. Actually, with Doc's physical detox and treatments and previous years and years of therapy, I can do that on my own now. I can address it.
Sure.
And he put me on a wonderful medication that's helped me. I think that's pretty much taken away my Tourette's.
Awesome.
Just right now, you can't probably tell, but when I was a kid, it used to be so bad I couldn't leave my house.
Sure.
I'll be in pain all the time just from them.
And that is an incredible thing in and of itself. One of the more incredible things that I've even seen while I'm here, because obviously that's something that's so, that's something that people can see.
Exactly.
And so, for your presentation, your disposition to be the way that it is very, very exciting. Where do you stand now? What's your outlook in the future? What are you looking to go back to?
I'm so excited because I had all these things holding me back. I was like, oh, I'm mold toxic, I'm OCD, I'm sheltered, I can't do any of these things because I'm so sick. And now because I'm 17, I'm like, oh, I can go to college this fall. Yeah. I can go to, I can get a job, I can do all these things, I can do whatever I want because I have all these tools. And Dr. Sponaugle taught me so much. Like I told him earlier, I said I came here when I was 16. And I'm leaving at 45 because that's how much I've gained.
All the maturation that you glean from all that, and that's something that's notable. So, well, Sadie, thank you very much. If you had anything to say to a 17-year-old girl like yourself, dealing with kind of a lot of the things that you have in your history, what would you say to them?
This is gonna sound really dumb, but people growing up told me that it's going to get better, and I would roll my eyes and say, no, it's not, But now I'm the person telling people it's going to get better. And I never thought I was going to be that person. I know that sounds really dumb, but I'm now saying that. And I used to be the person who didn't believe it. And I'm so blessed and lucky, and I really hope anyone not suffering any kind of illnesses related to this can come here and get help.
Sadie, thank you very much.
Thank you so much.